Some local healthcare providers are now going beyond just telling their patients to eat healthier, and they're hoping this new approach will make all the difference when it comes to fighting chronic issues. Our Jessica Brown went into the kitchen to see how it works.
We're gonna make an easy black bean quinoa burgers, okay?
Cooking class is in session in Chelsea.
We have our black beans, okay?
These free weekly classes are led by Claudia Guillen, a nurse at Mass General Brigham who teaches culinary and lifestyle medicine. She hopes to encourage her students to form healthier habits, and today, that includes me.
Am I doing it right?
Yeah, you're doing it right. And then why we wanna have beans? Because beans has a lot of fiber, okay? And the fiber is good for our gut. It's good for our digestive system.
The Teaching Kitchen is a partnership between Mass General Brigham and the community organization La Colaborativa, an organization that supports Latino immigrants in Greater Boston.
Right here, we're thinking about prevention. We want people to get better. We don't want you to get sicker. And what is making us sick? The food that we're eating.
Their focus to decrease rates of hypertension and diabetes.
Looked at the data, and as we met with community stakeholders, that is where the need is. So the ultimate goal is to really think outside the box in how we can conquer these health disparities that have gone on too long for preventable chronic conditions.
Quinoa,
Okay,
and the beans.
slowly, and the beans, okay?
Claudia says the hands-on approach of teaching how certain foods affect our bodies and new ways to create meals is already bringing healthier results.
We have seen they have lost weight. The hemoglobin A1C, which is what it tells us if the person has prediabetes or diabetes, has gone down, and hypertension also has gone down. So like if they've been taking like 5 or 6 medications, now maybe they're taking 2.
This was easy though.
It is
It's
easy.
not hard.
It's not hard.
Oh man.
A big reason Elsa Rodriguez has been coming to class every week. She says she's determined to learn what she can for her mom, who has diabetes.
This is gonna help me to, cook with my mom, or introduce some more different vegetables or different kind of food.
Most amazing thing that people like to do after we cook is what?
Eat.
Eat.
Our goal is to dramatically transform health for all community members, particularly Latinx and immigrant residents. So our goal is to address all of this comprehensively, to address the vulnerabilities that families face, and to do that through a dignified and empathetic lens.
Well, Mass General Brigham is calling this initiative Bridge to Health. The ingredients used in the Teaching Kitchen come from right next door in the food pantry at La Colaborativa, and that's intentional. So residents who come for assistance can also learn to create healthy meal habits all in one place. I'm Jessica Brown for WCVB News Center 5.
Thanks, Jessica. Meeting the need to access fresh food is the motivation behind a new collaboration between the City of Boston, Mass General Brigham, and the YMCA of Greater Boston. Here to explain how the new partnership will work is Tracy Sylvan. She's Director of MGB Community Health and Senior Advisor of Community Nutrition, Equity, and Social Risk Mitigation. Hi, Tracy. How are you today?
Great. Thanks for having me.
Good to see you. So according to the Greater Boston Food Bank's annual report that was released this past spring, about 1.9 million adults went hungry in Massachusetts last year. What is the role of this new collaboration in the fight against food insecurity?
This is really a unique collaboration between the 3 organizations that you mentioned, as well as several other organizations who are doing the work in food insecurity and food access. This hub will allow more fresh refrigerated food. It will allow for cold storage, which is critical in increasing access to fresh foods and vegetables. It allows the food to remain safe and reduces food waste for food that would otherwise go to a landfill.
So if you would explain a little bit more about how this hub is going to fit into the work that you do around nutrition and social determinants of health.
Sure, we know that food is an essential need for all of us and is essential for our health. We know that people who don't have enough food and who suffer from food insecurity also have worse outcomes around hypertension and diabetes. They suffer from obesity and even mental health. Those have all been reported in a Greater Boston Food Bank 2024 statewide report. We also know that people who have food insecurity have to make tough decisions. They have to decide between paying their utility bills or rent or medical care and prescriptions and transportation, which all impact health and living.
This is a very focused, targeted community effort. How did Mass General Brigham get involved with this?
We've had a long-standing partnership with the Y and the city and others in the community doing food insecurity. It's one of our priority areas that was identified through our community health needs assessment, which we do every 3 years. So when this opportunity came up, it was really just aligned with all of our priority areas and how we want to interact with the residents of Boston to help impact health needs.
So Tracy, there are a lot of programs around Boston that are trying to tackle this issue. What makes your program, this program, so unique?
It's really unique is the ability to reduce food waste, the refrigeration that's going to be available to all of the partners that will be involved in this. And that's really what we found in studying and assessing the city needs, that refrigeration and cold storage was a huge barrier. So we're hoping that this not only reduces the waste of food and is able to provide additional food for the providers like food pantries and other stakeholders who are distributing the food to the end user in the community.
It's remarkable how much food is wasted. I remember seeing some stories right after Thanksgiving about just the tons of food that people were throwing away. So this is hopefully going to change that paradigm in this neighborhood?
Absolutely. And really for the entire city of Boston, we're really hoping that this changes the 130,000 tons of food waste that we see every year, which was calculated in an assessment done by the Office of Food Justice, working with the National Resources Defense Council. So we're really hoping that that reduces and that we can get that food out to the residents of Boston who need it.
So how do you manage food waste? It's about, the right portions prior to starting the meal, and what happens to the food if they don't finish the meal? How does that work?
So the reducing the food waste, there are lots of organizations that we'll partner with through this collaborative hub that are the experts in really helping to rescue and recover these foods, and they'll have the access to bring it to this food hub, and then it will just be distributed out to the organizations serving the end users.
Okay, Tracy Sylvan, thank you so much for being here. Director of MGB Community Health and Senior Advisor of Community Nutrition, Equity, and Social Risk Mitigation. Thanks for joining us.